Hello, Pain Free for Life members. This is Dr. Rob Van Bergen, and today I'm back to our regular 10-minute Monday trainings, and I'm bringing you another one voted on by the community. So today we're going to be talking about treating fungal infections with microcurrent. This is actually something that comes up a lot. Obviously, there's quite a big prevalence of fungal infections out there. And I think people already have microcurrent equipment and are wondering, is this something I can do for this? But it's not something that has any official training. So I'm really pleased to get some official training out there on the whole process. So fungal infections can affect anyone, and they appear on several parts of the body. A jock, for example, with athlete's foot, a baby with thrush, an adult who uses an inhaler and doesn't wash their mouth out afterwards with thrush, a woman with a vaginal yeast infection. These are really common fungal issues and probably among the most common that come up when I'm talking with people. Now, so because of this, different types of fungi obviously exist, and these different fungi cause fungal infections that are often different than others. So in some cases, fungi that aren't typically found on or inside your body can colonize it and cause an infection. And in other cases, those that are normally present in or on your body can multiply out of control and cause infection. So there's multiple different things that can happen. So fungal infections typically, though, regardless of the infection, manifest in a variety of symptoms that fall into this short list of 6 different things. So redness, swelling, sores and blisters, I kind of lump those together, itchiness, burning pain, discharge. These are the general things that we see, regardless of what kind of fungal infection it is. Now, fungi are living organisms. And when it comes to microcurrent, we always talk about this because I get this question a lot as well. Is it possible to kill these organisms, like kill bacteria, viruses, fungi? Can we kill them with microcurrent? Now, no, we're not. There's no specific frequency we have access to that can kill different types of fungi. And the reason I say we have access to is because there's evidence in rife technology that you can in fact kill pathogens, but typically you're going up into really high ranges of unbody friendly microcurrent. So something along the lines of 10, 20, 100,000 hertz. Now, bearing in mind, the highest we go up to is 2,500. So we are not really reaching those realms where essentially we would be overwhelming the organism with electricity. But there's always room for damage to the body as well. So we don't have that capability. We're not killing organisms. However, microcurrent can help control the symptoms and also alter the environment of the body, which can make it nigh impossible for fungi to thrive. So first off, any itching, redness, swelling, and pain is inflammation. So the first thing to note is that any frequency above 100 hertz is capable of reducing and eliminating inflammation. So, something like 350 hertz in the evolution, even blue stimulate or 121 in the Genesis, or modulate, or really any of the SANA programs in the Pinnacle, which all include an anti-inflammatory component. So simply applying the electrode to the area for 2 to 5 minutes, and you can either hold it in place or move it around. A lot of the time, fungal infections are fairly localized, so holding it in place is the best option. Encouraging everyone to remember to wash their electrodes afterwards, as fungal infections can be contagious, especially if you're treating other people outside of you. But even if you're treating yourself, if you're treating a fungal infection on your foot, you don't then want to be treating your vagus nerve with the same probe without cleaning it, because you could spread the fungal infection. So that's point one. The inflammation being reduced will help with itchiness, redness, and swelling. Okay. Secondly, any sores or blisters that are forming are a form of wound that is lacking circulation to heal. Now, a lot of the time, this circulation can be smothered by this infection. So you're just not getting the circulation in there. But microcurrent passively enhances circulation. There are some programs that are better than others. Vaso, FMRSI, Blue Stim, these all come to mind. So after you've done your 2 to 5 minutes of anti-inflammatory, you want to run around 15 minutes of a circulation enhancing program. If you have an Avasia Life Pinnacle, you can skip both of these steps and simply do 1 to 2 cycles of Sana IP. Now, Sana IP is your injury protocol, wound healing protocol, and it is going to get the job done in half the time and essentially do all of those things I just mentioned. However, after you've done this, you're going to want to look at 2 other protocols as well. These 2 protocols are very similar. I talk about them all the time, and they alter the body's environment on a cellular level, okay? So number 1 is grounding. The grounding protocol uses 7 to 12 hertz, and you simply connect your conductive pads or socks and gloves to the device, preferably all 4 at once. So a pad on the hand, a pad on the foot, a pad on both palms of your hands and a pad on both soles of your foot. And if you can't do that, or if you have the gloves and socks, then ideally you do all of those. Otherwise, you want to do one side of the body at a time. Pad on the hand, pad on the foot. So you simply do that and you run the program for 30 minutes, okay? Then mitochondrial recharge. You got the exact same setup, but you're using blue stimulation. So this program is run for 15 to 30 minutes. You probably do 15. You don't want to be hooked up to this for an hour. But what this is doing, both protocols here should be completed daily. The grounding protocol is helping to normalize pH in the body, your potential for hydrogen. So though certain fungi don't mind too much about pH, it's sort of helping to, build things up and optimize the environment. But bearing in mind, again, certain fungi do not really care too much about pH. So it's not as crucial as the mitochondrial recharge protocol, which actually works to optimize cellular energy body-wide. So when cells are optimally charged, they become nigh impervious to infection and to disruption from everything, meaning that in essence, they actually stop the growth of the fungi. So ultimately, it is worth remembering that microcurrent is going to be far better at halting the growth and spread of a fungal infection and preventing them from occurring than it is at reversing them. But the treatment options that I have covered here are truly optimal choices for people who are looking to treat fungal infections with microcurrent. So do them. I'm not saying that it's going to reverse the condition, but it has done in the past. And it is one of those things that, again, is better at halting the growth and spread and preventing them from occurring in the first place than it is at treating them, just because we're not killing living organisms. But optimizing the environment, dealing with the symptoms of the inflammation and the lack of circulation is going to bring healing to the body. Okay, so that's it for fungal infections. So I hope you found this video helpful. I hope this is the answers people were looking for. If you have any questions at all, please do not hesitate to ask. Thank you all for joining me, and have a wonderful rest of your week. Take care.